we have a lot to talk about. Or at least I have a lot that I need to talk about, and what better way to just get all my thoughts out than to put them on here. So, hi everybody, welcome back to my channel. If you don't know me, my name is Devin, and I make content about all things mental health and chronic illness. And today we're going to be talking about pain. I should probably catch you up a little bit first as to why I'm even considering this treatment in the first place. But I have been dealing with chronic pain since last August. Most of you will know that. I've had many vlogs trying to deal with this pain, but recently it's been bad. I don't really go anywhere except from my bed to the couch and back to the bed. Occasionally I can sit up in my chair and hang out at my computer with my husband, but even that hurts so bad. I'm going to my doctor's appointments. We're trying to figure this out. I finally got a referral that I was waiting on, so I'll be going to see a specialist in Atlanta, and hopefully we're figuring out what's going on. But in the meantime, I am in so much pain all day, every day, and I can't take it anymore. I can't live like this. On a scale of 1 to 10, I probably live at an 8 or above. I can't tell you the last time I had a day that I felt was under an 8. I also, unfortunately, can't take a lot of pain medications because of my autoimmune disease. I can't take any sort of NSAIDs, and that eliminates Advil, Aleve, all of those sorts of things. I can't think of all of them off the top of my head. But essentially, my only pain options for medication, or at least this is what I thought, was either Tylenol or Percocet. So either acetaminophen, which, let's be honest, Tylenol doesn't work. It doesn't work for pain, especially not for this. And it really can mess up your liver, I think. Tylenol's liver? I believe so. Anyway, with the amount I would have to take to even try to put a dent in my pain, not worth it. And then on the other side, you have opioids. And I am terrified of those. I have seen multiple people in my own life deal with opioid addiction. Addiction already runs in my family. I have an addictive personality. It's just the idea of going on pain medication like that really, really scares me. And honestly, I thought that was going to be my only choice because the pain has gotten so bad that it is really, really messing with my mental health. So as I said before, I'm still going to all my doctor's appointments. We're still trying to figure it out. We have a possible diagnosis, but I have to go to the specialist to get tested. The orthopedic specialist that I am seeing suspects a certain diagnosis. So we're going to see if that's the actual diagnosis. But again, all of this takes time, and in that time, I am in pain, and that pain is ruining my mental health. So when I went to my therapist this past week on Friday, it's now Monday. So today is actually June 7th, so happy Pride Month, everybody. I'm hoping to be able to get actual queer-related videos up this month, but I don't know. This whole thing is completely thrown me. Either way, I usually have all my appointments on Fridays, so I went to my therapy appointment, and the first thing I said to her was, I am in so much pain every day that it makes me want to end everything. What can we do? And she thought there for a minute and then said, have you ever heard of ketamine? Now, if you're like me, you might be like, isn't that like a street drug? It can be. However, it has been used as an anesthesia or an anesthetic drug for centuries, for a really long time. It's used very often with vets and with horses. It's known as a horse tranquilizer, but people take it because it gives them dissociative effects. It makes them feel separate from their body, and they enjoy that kind of high when you're abusing the drug. So it is technically the same drug that people do abuse on the street. However, it is at a much, much lower quantity, much, much lower milligram. The way they do this treatment is actually through infusions. I don't know how much they're going to give me. It depends on your weight, but it's a very low amount over a period of hours. And you have someone there watching you and making sure that you're okay through the whole thing. And having to go to the center, having somebody monitor you, having somebody give you the medication, but you can't take it home, that really lowers the risk of any sort of abuse or addiction or anything like that. Actually, the woman I talked to straight up told me she would not let me get addicted. So that made me feel really good, because she said, I won't give you enough to get you addicted, and if you are, you're not getting any more. She screens for it all, so I felt a lot safer with that part of it, because there is an addiction part of ketamine. Obviously, anybody can really get addicted to anything, but I am much less likely to get addicted to ketamine infusions that I get once every month or so eventually than I am to be addicted to pain pills that I have to take every day, multiple times a day, and I have direct access to. Two totally different things. So that did make me feel a little bit better. My therapist gave me a little bit more information, and we brought my husband in and we all talked about it, and we decided that we wanted to have a consult with the woman who does these infusions. So after we left my therapist appointment on Friday, I did do a little bit of research, kind of sat on it and tried to think about what I wanted to do if I wanted to take this course of action. My therapist recommended this to me for multiple reasons. The first was for the chronic pain. The second, and well, I guess the second reason altogether, is my mental health. Ketamine infusions can also be used to treat depression, anxiety, and PTSD, all of which I am suffering from. My therapist now that I have a specialized trauma therapist, has told me very specifically, you very clearly have PTSD. But anyways, the ketamine infusions helps with all of that. And she actually said that some of her patients that go and do the ketamine infusions, it actually makes what happens in therapy a lot easier, just because of the way that this medication works on their brain. The medication itself only stays in your system for about 10 to 12 hours, so it's not really the medication that has had this drastic difference in both my therapist's patients, but also other people that I have heard from, and just people who I have seen their experience with these ketamine infusions or have read their experience. Apparently, the change can be quite dramatic. The change can be very dramatic. And that's really why my therapist offered it to me, because I need something dramatic. Nothing else is working. Nothing else is working. And I really just don't want to live like this anymore. So the medication isn't in your system that long, but what it does is it takes all of the cells, the neurons in your brain, that when you create a habit, when you do things, when you say things, you're always making connections in your brain. The more you do something, the stronger those connections get. When it comes to chronic pain, that can become an issue, because the signal is constantly sending pain back and forth and back and forth and back and forth and back and forth, strengthening that pathway, strengthening those messages, making the pain worse. And what ketamine is able to do is it allows your brain to completely light up. All the areas of the brain are activated, and it starts making new connections. And all of those new connections allow the body to behave differently, but it also allows you to really perceive things differently. And that can be very, very helpful when dealing with people who live with chronic depression, anxiety, and PTSD like I do. So Friday was my therapy appointment, and Sunday night I got a phone call from the woman who does these infusions, and we talked. She gave me some information. I have my little notes, because apparently the only thing I had in front of me was a Post-it note at the time. So when a person starts ketamine infusions, if you're going for chronic pain, you get a higher dose. If you're going for mental health issues, you typically end up getting a lower dose. So I will end up getting a higher dose than people going just for mental health issues. When you start the infusions, you start with a series of 6 of them, and you do those infusions within 3 weeks. The first infusion is 2 hours long, and it's because they just kind of want to make sure that you're okay. They want to see how your body reacts to it, how your brain reacts to it, to just see how your body and the drug interact together. So they do the first one shorter. The rest of those 6 sessions, so the next 5, are 4 hours long. I obviously can't drive myself home, but that doesn't really matter anyways because Jake is driving me everywhere right now. After those first 6 infusions over the 3 weeks, we then wait 2 weeks and do another infusion, another one of the 4-hour infusions. And then we wait 3 to 4 weeks and then do another 4-hour infusion. The goal is to separate and lengthen the time between infusions as much as possible. The woman said that she has one client who only comes in once every 3 months. So the goal is to limit the amount of infusions you have to keep feeling the effects. Essentially, they give you this huge booster at the beginning and then just give you maintenance doses. I don't really know why. The medication itself isn't that scary to me. Maybe it is because, again, it's in a very controlled environment. I go there, they give me my medication, I come home. And how incredible would it be to only have to take your pain medication once a month? Once every 2 months, once every 3 months. Like, that is insane. They also talked about the possibility of being able to lower my other medications that I'm on, my other depression or anxiety medications, depending on how I react to these treatments. So the treatments themselves, that's not holding me back. What's holding me back is the cost. Ketamine infusions are not covered under insurance in the United States. And when we first talked to my therapist, she had given us a number. It wasn't great, but we thought we could make it. It was definitely less than what we got. So we were like, okay, thinking about it over the weekend, because again, I had therapy on Friday. We had my consultation Sunday night. So we didn't know until Sunday night how much these were actually going to cost. And it's now been about 24 hours since then. Today's Monday, and my brain still can't get over this cost. The first session, the 2-hour session, is $300. Every session after that is $800, which means just for the first 6 sessions alone, it'll be over $4,000. I want to throw up saying that. And not only that, it's over $4,000 up front, and then it's $800 every time after that. So then it's at least $800 a month, possibly more than that, depending on how often I have to get my infusions. Because some people can go straight to every 4 weeks. Sometimes people have to do every 2 weeks or every 3 weeks for a little bit. So like, it's at least $800 a month for the foreseeable future, on addition to this $4,000. I'm still not working. I'm actually currently looking into the possibility of getting disability, seeing if that'll work. I have to talk to all of my doctors about that. But like, I was desperate. I've been desperate to find something that will work. Something that I can take that'll take this pain away, or at least make it more bearable while I have to be in it. Because it's been awful. And then when I talked to my therapist, the first thing she mentioned was this, and it was something that really could help. Could really honestly change things. But then you put that price tag on it. There have apparently been rumors that insurance companies are going to start covering these infusions, partially in some places. The woman I talked to said that she had heard about Tennessee, maybe? I don't know. A Blue Cross Blue Shield of some state paying for somebody's. So she told us that she will give us an itemized bill and that we should send it into our insurance, because it is possible for them to cover it or cover part of it. Like, things are starting to change around that. But she has yet to have one person that she knows personally have it happen. Like, none of her patients, none of her clients have had theirs covered. So, like, I'm not hopeful, especially not in Georgia. We don't even have medical marijuana here. So, I don't know. I need to figure out what I'm gonna do. I do want to say, I want to put this out there because I know that talking about money can sometimes come across as, ooh, give me money. That's not what this is. I just want to be real and honest with you guys, and real and honest about the fact that it's possibly going to cost me $5,000 to get out of this pain. But is it worth it to not be in pain? That's the thing. Like, it's really hard. It'd be really easy to just say, yeah, go for it if we had this huge disposable income. But we, like the vast majority of people, don't have just thousands of dollars sitting around. So, especially not after this pandemic, I've been unemployed since March. And I think that my story is nowhere near as rare as you'd think. There are so many people right now trying to make similar decisions, trying to make similar health decisions. Do I go get that MRI? Do I go to the hospital? Do I go to the doctor? Can I actually afford to pick up my meds this month? There's a lot of people trying to figure out how much their life is worth, how much their quality of life is worth. And that's a really weird place to be in. I have an appointment coming up with my nurse practitioner who covers my psych meds, and I'm going to talk to her about it. And I don't pray, I'm not a religious person, but I'm just going to sit on it and see what my gut tells me to do. And I know my quality of life would be way better on that than it would be on pain meds. But also, pain meds are covered by insurance. These are the choices we have to make, right? These are the choices we make as disabled people in America. And it fucking sucks. I feel a little bit better. At least talking it through. I'm probably gonna have to talk this through again with every single one of my friends. So I'm sorry if you've already watched this and then had to hear a phone call from me. I love you though. Anyways, my camera's dying. My food's probably getting cold out there. I needed to talk. Thank you for listening. And if there are other people out there dealing with similar things, you're not alone. We'll get through it. I hope, really, really hope that I will have some gay content for you guys coming soon. But for right now, this is the part where I tell you, if you haven't already, to smash that like button, click subscribe, and ring the notification bell. I'll see you guys next week. And I'm back for a little update because I've cried like 3 times. I talked to my husband. I cuddled with the dogs. I got to spend time with them while they ate, which Sadie has been having food problems and only likes to eat when I'm sitting right next to her. But it was a nice family moment. And I realized that I would do this for literally any of them. I would pay this much money 5 times over for any one of them. So Jake told me to invest in myself, to not sell myself short. Told me to remember my tattoo. If I can. I'm worth it. It's really hard for me to not think of doing these treatments as something that is just completely selfish. But like, we're gonna do it. We're gonna do it. It's the right thing to do. I'm not gonna let money stop me from having any sort of quality of life. I can't do that anymore. I can't. We're gonna sit down and we're gonna figure it out financially, but Jake told me to go ahead and schedule the appointment. And I still wanna wait to talk to my therapist, not my therapist, my nurse practitioner. But it looks like I'm gonna be doing ketamine treatments, guys. So look forward to those videos coming up. I'm trying not to get too hopeful, but I'm not gonna lie. This stuff could change my life. We'll see. I'll see you guys next time, for real this time.